In this video, we will talk about 10 critical mistakes in using lemon juice that can seriously harm your health. These mistakes may lead to stomach ulcers, heart issues, problems with the liver and kidneys, and even contribute to the development of cancer. From harmful combinations with other foods to risky use in skincare, you might be surprised to discover the hidden dangers that lemon juice can carry. Make sure to watch until the end to protect yourself and avoid these dangerous traps. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Number 10, combining lemon juice with foods that contain nitrates. At first glance, this might seem harmless or even healthy. Lemon juice is often added to salads and dishes with vegetables like beets, lettuce, or spinach, all of which are naturally high in nitrates. However, this combination can be a harmful mistake that poses a serious risk to your health by increasing the likelihood of developing cancer. During digestion, citric acid in lemon juice interacts with the nitrates in these vegetables, which can lead to the formation of nitrosamines, chemical compounds known to be carcinogenic and recognized as risk factors in the development of cancer. When lemon juice is consumed together with nitrate-rich foods such as spinach, radishes, beets, or lettuce, a chemical reaction begins. This reaction transforms otherwise harmless nitrates into dangerous nitrosamines. Studies conducted by the American Cancer Society confirm that nitrosamines contribute to the development of cancers in the stomach, esophagus, and colon. These compounds are especially harmful because they can damage the DNA of cells, causing mutations and uncontrolled cell growth, which is one of the main mechanisms behind tumor formation. According to a study from Stanford University's School of Medicine, nitrates in small amounts are considered safe and can even be beneficial, as they help widen blood vessels and improve circulation. However, when nitrates come into contact with acid, such as citric acid, they can be converted into nitrosamines, which are carcinogenic compounds. This becomes especially dangerous if you regularly consume foods that may contain nitrates, including vegetables grown with nitrogen-based fertilizers. In 2019, a case in Germany illustrated the seriousness of this mistake. A 47-year-old woman named Katharina Müller, who was committed to living a healthy lifestyle, often prepared salads with beets and spinach, regularly dressing them with lemon juice. She firmly believed that this combination was very good for her health. Several years later, she began experiencing frequent stomach pain and heartburn. After undergoing a series of tests, doctors diagnosed her with stomach cancer, which was found to be linked to prolonged exposure to nitrosamines. Katharina had been exposed to these harmful compounds on a regular basis by frequently eating salads that combined lemon juice with nitrate-rich vegetables. To avoid making this dangerous mistake, it is important to remember that it is safer to use lemon juice with foods that do not contain high levels of nitrates. For example, instead of using beets or spinach in salads, you can opt for vegetables like cucumbers or tomatoes, which do not react with citric acid. It is also important to pay attention to where your food comes from and try to avoid vegetables grown with nitrate-based fertilizers. According to data from the United States National Cancer Institute, there are specific guidelines on selecting vegetables that are low in nitrates. It is also recommended to use organic produce, as these typically contain fewer pesticides and chemical fertilizers. If you still decide to combine lemon juice with vegetables such as spinach or beets, it is important to limit how often and how much of these combinations you consume in order to reduce the risk of nitrosamine formation in your body. Number 9, using lemon juice regularly to clean your teeth. At first, it might seem like a natural and even beneficial method. Some people believe that the high acidity of lemon can whiten teeth and remove plaque. However, this belief is a dangerous myth that can lead to serious consequences for your oral health. In reality, lemon juice breaks down tooth enamel, leaving your teeth vulnerable to infections and other dental issues, potentially even leading to tooth loss. Tooth enamel is the hardest tissue in the human body. It serves as a protective barrier that shields your teeth from acids, bacteria, and mechanical stress. But once enamel is damaged, it does not regenerate. According to a study conducted by the American Dental Association, exposure to acids like citric acid can gradually erode enamel, leading to increased tooth sensitivity, pain, and accelerated tooth decay. Lemon juice, which has an acidity level of approximately 2.5 on the pH scale, is highly corrosive and can quickly wear down this protective layer, leaving the teeth defenseless against erosion and infection. Acid erosion is a serious issue. According to research from the University of Michigan, 1 in 3 adults experiences enamel erosion, especially among those who use acidic substances as part of their dental care routine. In the later stages of erosion, teeth can become so weakened that they start to break down, and infections can spread beyond the teeth to surrounding tissues. A clear example of this is the case of 34-year-old Mark Wilson from London, United Kingdom. Mark used lemon juice for a long time in an attempt to whiten his teeth, believing it was a natural and safe method. However, after several years, he began to notice increased sensitivity and discomfort while eating and drinking. Eventually, his dentists discovered severe enamel erosion, which led to tooth breakdown and the need to remove several teeth. Mark ended up requiring expensive dental procedures to restore his smile, but the damage was already irreversible. To prevent enamel erosion and other serious problems caused by lemon juice, it is essential to avoid using acidic substances for brushing your teeth. Instead, rely on safe oral hygiene products recommended by dental professionals, such as fluoride-containing toothpastes and professional whitening systems if teeth whitening is needed. In addition, the Academy of General Dentistry strongly advises against prolonged contact between acidic substances like lemon juice and your teeth, as it can cause permanent damage. If you enjoy the taste of lemon, it is better to add it to water, but make sure to rinse your mouth with clean water immediately afterward to wash away any remaining acid and help protect your enamel. Number 8, regularly consuming lemon juice with sugar, especially when calcium levels are low. Lemon juice mixed with sugar is a popular combination that many people enjoy in their drinks, often thinking it is healthy. It might seem harmless: vitamin C from the lemon, a bit of sweetness for flavor, and a refreshing feeling on a hot day. But regularly drinking lemon juice with sugar, particularly when your body is already low in calcium, can lead to serious health consequences that most people are not aware of. The first and most obvious risk is the sugar itself. A study conducted by Harvard Medical School warns that excessive sugar consumption is linked to several serious health conditions, including obesity, type 2 diabetes, and heart disease. On its own, lemon juice is low in calories, but adding sugar significantly increases the calorie content, which can lead to weight gain and metabolic syndrome. This syndrome, in turn, raises the risk of heart attacks and strokes. Statistics show that nearly 40% of American adults are either overweight or living with obesity, and this is closely tied to high sugar intake. But sugar is not the only concern. The citric acid in lemon juice has a strong effect on calcium depletion. Research from the American Association for Osteoporosis has shown that acid from citrus fruits can lead to the loss of calcium from bones, especially in people who already have a calcium deficiency. This process can result in osteoporosis, a condition where bones become weak and brittle. The gradual loss of calcium also increases the likelihood of bone fractures, even from minor physical activity. The combination of sugar and citric acid creates a double threat. Sugar contributes to inflammation throughout the body, which makes bones even more vulnerable to fractures, while citric acid actively draws calcium out of the bones. As a result, not only do your teeth suffer, as discussed earlier, but your entire skeletal system is affected. The story of Lisa Martinez from Mexico clearly shows how serious this mistake can be. Lisa, 52 years old, always cared about her figure and regularly drank lemon water with sugar, believing it helped her stay healthy and aided digestion. She never considered her calcium levels might be low, especially since she rarely consumed dairy products. Over the years, Lisa began to experience severe pain in her lower back and joints, especially during any physical activity. After undergoing medical tests, doctors diagnosed her with osteoporosis, which had developed from years of calcium deficiency, combined with repeated exposure to acids like citric acid. Simple everyday actions, such as walking to the store or bending down to pick something up, eventually led to a hip fracture that required major surgery. To avoid such issues, it is important to limit your intake of lemon juice with sugar. If you want to add lemon juice to your drinks, consider using alternatives to sugar, such as honey or natural sweeteners with a low glycemic index like stevia. These options can help reduce the risk of metabolic syndrome and weight gain. Additionally, people who are prone to calcium deficiency should be especially cautious when consuming acidic foods. Tufts University recommends regularly checking your calcium levels and taking calcium supplements if necessary to maintain bone health. Including calcium-rich foods in your diet, such as broccoli, almonds, and dairy products, can also help offset the effects of acidic foods. It is also important to rinse your mouth with water after drinking lemon juice. This simple step helps neutralize the acid's effect on your teeth and bones, protecting your enamel and reducing calcium loss, keeping you healthier for years to come. Number 7. Adding lemon juice to marinades for grilled meat. Who does not enjoy juicy, flavorful grilled meat? And when it is marinated in lemon juice beforehand, it becomes even tastier and, as many believe, healthier. Lemon adds a pleasant, tangy flavor to meat, helps tenderize it, and brings the benefit of vitamin C. But behind this culinary technique lies a hidden danger that every barbecue lover should be aware of. When lemon juice is used to marinate meat, and then that meat is cooked at high temperatures on a grill, a chemical reaction takes place that can negatively affect your health. The proteins and fats in the meat react with the acid from the lemon juice under high heat, leading to the formation of compounds harmful to the body, specifically heterocyclic amines and polycyclic aromatic hydrocarbons. These substances are considered among the most dangerous carcinogens and have been linked to the development of cancer in the stomach, colon, pancreas, and even breast tissue. The American Society of Clinical Oncology conducted extensive research confirming that cooking meat over an open flame or at extremely high temperatures significantly increases the formation of these harmful compounds. The danger grows when juices from the marinated meat drip onto hot coals or the grill, producing smoke filled with carcinogens. That smoke then rises and is absorbed back into the meat. According to studies, regularly eating meat prepared this way increases the risk of developing cancer by 30 to 40%. In addition, researchers at the Center for Food Technology and Nutrition at the University of California have warned that acidic marinades like lemon juice further increase the production of these cancer-causing chemicals. As a result, your favorite grilled dish might turn into a serious long-term health risk. Carlos Rodriguez from Brazil was a true grill master. At 45 years old, he hosted weekend barbecues for family and friends almost every week. His specialty was meat marinated in lemon juice, spices, and oil. Carlos believed this combination made the meat both tastier and healthier. But over time, he began to experience persistent stomach pain, heaviness, and heartburn. After undergoing medical tests, doctors diagnosed him with stomach cancer, a condition that was later linked to his long-term habit of eating grilled meat marinated in lemon juice. The treatment process was long and difficult, and Carlos had to completely change his eating habits. To avoid such serious consequences, there are a few simple but effective rules you can follow. First, reduce cooking time at high temperatures. Instead of grilling meat for long periods over open flames, try braising or baking, which use lower temperatures and help minimize the formation of harmful compounds. Second, avoid using lemon juice in marinades if you plan to grill the meat. Instead, opt for herb-based marinades. They not only enhance flavor, but also help reduce health risks. Studies from the American Institute for Cancer Research have shown that ingredients like rosemary, garlic, and thyme can decrease the formation of carcinogens when grilling meat. Finally, pay attention during the cooking process to prevent juices and fats from dripping onto the flames, which causes harmful smoke. Use aluminum foil or specially designed grill accessories to reduce the amount of toxic substances released during grilling. Number 6, excessive use of lemon juice in cases of high blood pressure and adding it to salty dishes. Lemon juice is a popular ingredient often used in salad dressings and marinades. Its refreshing taste adds a distinct flavor to many meals. While it does offer benefits like a high content of vitamin C and antioxidants, overusing lemon juice can pose a serious risk for individuals with high blood pressure, especially when it is combined with foods that are high in salt. Citric acid can stimulate the production of gastric juices and may lead to fluid retention in the body. However, the most concerning combination is lemon juice with salty foods. A study by the American Heart Association reports that a high sodium intake can contribute to elevated blood pressure. And when this effect is intensified by acid, such as the citric acid found in lemon juice, the risk of a hypertensive crisis increases significantly. High blood pressure is one of the most widespread chronic health conditions in the world, affecting more than 1,130,000,000 people. According to research from Stanford University, excessive intake of sodium and acid may accelerate fluid buildup in the body, putting additional strain on the heart and blood vessels. As a result, this can cause a sudden spike in blood pressure that may lead to a heart attack or stroke. Lemon juice combined with salty foods such as salted fish, cured meats, or canned goods only worsens the issue by impairing vascular function and triggering cardiovascular events. Notably, research from the National Heart, Lung, and Blood Institute also highlights the danger of this combination. Their findings show that a high concentration of sodium, when consumed along with acidic ingredients, can speed up the breakdown of blood vessel walls. This increases the risk of vessel rupture and stroke. A powerful example of the danger of overusing lemon juice with salty foods is the story of 58-year-old Marina Lopez from Spain. A devoted fan of Mediterranean cuisine, she often prepared fish and meat dishes seasoned with lemon juice and salt. She believed this gave the food a fresh and vibrant taste. However, one evening after a heavy meal of canned fish flavored with lemon, Marina experienced severe dizziness and chest discomfort. At the hospital, she was diagnosed with a hypertensive crisis and a mild stroke. Doctors explained that her condition was caused by elevated blood pressure brought on by the combination of salt and acid, which dramatically increased the strain on her cardiovascular system. To avoid such dangerous outcomes, it is important to monitor your intake of both sodium and acidic foods, especially if you're living with high blood pressure. The University of Massachusetts Medical Center recommends limiting daily salt consumption to 1,500 milligrams and avoiding combinations of high sodium foods with acidic ingredients like lemon juice. There are also healthier alternatives to salt in cooking. Instead of using salt, you can enhance flavor with herbs and spices, such as basil, rosemary, or thyme. These not only add depth to your meals, but are also safe for your health. If you enjoy the taste of lemon juice in your food, try reducing the amount of salt or use other natural flavor enhancers like garlic or ginger, which also offer health benefits. Lastly, it is important to regularly monitor your blood pressure and follow your doctor's dietary recommendations. High blood pressure is a condition that requires careful management, and avoiding harmful combinations like salt and lemon juice can help protect your cardiovascular health and prevent serious complications. Number 5, using lemon juice for kidney conditions and in detox programs. Many people believe that lemon juice is the key to cleansing the body and promoting weight loss. They add it to detox drinks and cleansing routines, thinking that its acidity will help eliminate toxins and support organ function. However, what seems beneficial at first glance can actually be dangerous, especially for those who already have kidney issues or rely too heavily on detox programs. Lemon juice contains a high level of oxalates, a naturally occurring substance that, when consumed in excess, can negatively affect kidney health. Research from the American Urological Association warns that an excessive intake of oxalates can lead to the formation of calcium oxalate kidney stones. Oxalates bind with calcium in the urine to form solid crystals, which can grow into stones over time. This risk is especially high for individuals who are predisposed to kidney stones or who already suffer from kidney disorders. In addition, so-called detox programs, which are popular among those pursuing a healthy lifestyle, often include large amounts of lemon juice. Studies from New York University School of Medicine caution that long-term use of detox regimens can cause an electrolyte imbalance and dehydration, which place extra strain on the kidneys. A lack of fluids and electrolytes disrupts the body's ability to filter blood properly and can lead to kidney dysfunction. Further research conducted at the Johns Hopkins University School of Medicine found that people who regularly consume lemon juice as part of detox diets have a higher risk of developing chronic kidney disease. When oxalates are not effectively eliminated from the body, they can accumulate in the kidneys, causing inflammation and pain. A striking example of the dangers associated with excessive detox practices is the case of Jean-Pierre Bouchard from France. At 43 years old, Jean-Pierre wanted to improve his health and began following lemon juice-based detox diets. He drank several glasses of lemon water each day, believing it would help cleanse his system and improve digestion. However, after a few months, he started experiencing severe pain in his kidney area. At the hospital, doctors diagnosed him with large calcium oxalate kidney stones that required surgical removal. It was determined that his condition was caused by the frequent intake of lemon juice, which is rich in oxalates. To prevent such health problems, it is important to be cautious when consuming lemon juice, especially for those with a history of kidney issues. First, reduce your intake of lemon juice if you are prone to kidney stones or have any type of urinary tract condition. The National Institute of Diabetes and Digestive and Kidney Diseases recommends avoiding excessive use of citric acid and oxalate-rich foods in order to prevent the buildup of oxalates in the body. It is also wise to avoid prolonged or extreme detox programs. Instead, focus on balanced nutrition and proper hydration, which naturally support kidney health. If you do choose to include lemon juice in your diet, monitor your intake carefully and avoid exceeding the recommended amount. Consulting with a healthcare provider or dietitian is the best way to ensure that lemon juice is a safe addition to your nutrition plan. Number 4. Improper use of lemon juice in cosmetic procedures and skincare routines. Lemon juice has long been considered a natural remedy for brightening the skin, reducing age spots, and treating acne. Many people apply it directly to their face, believing its acidic properties will quickly fix skin issues. However, using lemon juice for cosmetic purposes can not only fail to deliver the expected results, but also pose a serious risk to skin health, especially when used incorrectly. Lemon juice is highly acidic, with a pH level between 2 and 2.5, which makes it an aggressive agent for the skin. When applied directly in its undiluted form, it can cause significant irritation, chemical burns, and can even make the skin extremely sensitive to sunlight. This reaction is known as phytophotodermatitis, a condition where the skin becomes inflamed and severely reddened after exposure to ultraviolet light. Research by the American Academy of Dermatology shows that this reaction is commonly observed in individuals who use citrus-based products in home skincare treatments and then go outside under direct sunlight. A study from the Institute of Dermatological Research at the University of Pennsylvania found that citric acid in lemon juice can break down the skin's natural lipid barrier, leaving it vulnerable to bacteria and environmental pollutants. This can lead to acne, inflammation, and even skin infections, including more serious conditions such as cellulitis. Over time, the skin may lose its ability to regenerate, resulting in premature aging, deep wrinkles, and permanent scarring. In addition, the National Association of Dermatologists warns that the improper use of acidic products like lemon juice can lead to chronic skin conditions, including dermatitis and eczema. This is especially dangerous for individuals with sensitive skin or pre-existing skin problems. The story of Ana Gonzalez, a 29-year-old from Mexico, shows how harmful lemon juice can be when used incorrectly in skincare. Ana wanted to lighten dark spots on her face and came across an online recommendation to use lemon juice as a natural brightening agent. She applied it to her face each evening, believing the acidity would help fade pigmentation. A few days later, after one of her treatments, she went to the beach without wearing sunscreen, unaware that the citric acid had made her skin extremely sensitive to ultraviolet rays. As a result, she developed a severe case of phytophotodermatitis. Her face was covered in burns, swelling, and hyperpigmentation that required months of treatment to heal. To avoid serious skin damage, it is important to remember that lemon juice is not suitable for direct cosmetic use, especially in its undiluted form. The American Society for Dermatologic Surgery recommends using only professional skincare products, which are specifically formulated with safe and balanced acidity levels. If you want to incorporate natural ingredients into your skincare routine, it is better to choose gentler acids like lactic acid or mandelic acid, which are less harsh on the skin. It is also essential to apply sunscreen after any skincare treatment that involves acids in order to protect the skin from harmful ultraviolet rays. Furthermore, the American Institute of Skin Health emphasizes that regular hydration and a well-balanced skincare routine are the most effective ways to keep your skin healthy and youthful. Instead of experimenting with aggressive treatments like lemon juice, focus on moisturizing, protecting, and maintaining your skin's natural barrier to avoid unwanted side effects. Number 3, regularly adding lemon juice to hot beverages, especially for those with acid reflux. For many people, starting the day without a cup of tea with lemon juice seems unthinkable. This familiar combination, often associated with freshness and health benefits, can actually pose risks, particularly for individuals who suffer from gastroesophageal reflux disease, also known as GERD, or those who are prone to stomach and esophageal issues. Lemon juice has a very high level of acidity, with a pH between 2 and 2.5. When it is added to hot beverages, it can significantly increase the overall acidity of what is being consumed. This becomes especially problematic for people with GERD, a condition in which stomach acid regularly flows back into the esophagus, causing heartburn and inflammation. Studies by the American Gastroenterological Institute warn that lemon juice added to hot tea or water can increase acid production in the stomach, worsening reflux symptoms and increasing the risk of erosions and ulcers in the esophagus. Research from the Gastroenterology Research Center has shown that GERD affects around 20% of adults worldwide. Poor dietary choices and the consumption of acidic drinks, such as tea with lemon, can aggravate the condition. Hot beverages with lemon juice can weaken the lower esophageal sphincter, the muscle responsible for preventing stomach acid from entering the esophagus. When this muscle is weakened, acid along with the lemon juice can travel upward, causing inflammation, pain, and damage to the esophageal lining. Additionally, frequent consumption of hot beverages with lemon can contribute to the development of ulcers. Citric acid is harsh on the stomach lining, especially when consumed on an empty stomach or by individuals who already have high stomach acidity. Research from the University of California has shown that when acid is added to hot beverages, it can accelerate the breakdown of the mucosal lining of the stomach and esophagus, leading to ulcers and erosions. The experience of Maria Santos, a 46-year-old woman from Spain, serves as a clear example. Every morning, she began her day with a hot cup of tea heavily flavored with lemon juice. She believed this ritual boosted her immune system and helped cleanse her body. However, after several years, she started experiencing persistent chest pain and severe heartburn after meals. Her symptoms worsened over time, and she was eventually diagnosed with gastroesophageal reflux disease. Doctors explained that her problems were caused by frequent exposure of her esophagus to stomach acid mixed with lemon juice, which led to inflammation and erosion. To avoid such issues, it is important to be cautious with the use of lemon juice in hot beverages, especially if you are prone to reflux or have other esophageal conditions. Mayo Clinic recommends limiting the intake of acidic foods and drinks, particularly for those with GERD. If you enjoy lemon in tea or hot water, it is best to use it in small amounts and never drink these beverages on an empty stomach. For individuals already experiencing reflux, it is best to avoid adding lemon to hot drinks altogether. Instead, consider herbal teas like chamomile or ginger, which are gentle on the digestive system and can have soothing effects. The National Institute of Health emphasizes the importance of maintaining a balanced diet and avoiding excessive intake of acidic foods to protect the health of the stomach and esophagus. If you are already experiencing symptoms of GERD or other digestive conditions, it is important to consult a gastroenterologist for proper diagnosis and treatment. Making dietary changes, avoiding lemon juice and hot beverages, and following a treatment plan can help prevent complications and keep your stomach and esophagus healthy for years to come. Number 2, using lemon juice in combination with alcohol, especially in cases of chronic liver disease. Many people enjoy the refreshing taste of lemon juice, especially when it is mixed with alcoholic drinks. Lemon-based cocktails like margaritas or gin with lemon tonic have become a regular feature at parties and celebrations. However, few people realize that this combination can be seriously harmful to the body, particularly for individuals who suffer from chronic liver conditions. Lemon juice is a strong source of acid, and when consumed with alcohol, it increases the toxic burden on the liver. Alcohol is already a powerful irritant for the liver, since this organ is responsible for breaking it down and removing it from the body. When citric acid from lemon juice is added to alcohol, it stimulates bile production and pushes the liver to operate at full capacity. For people dealing with chronic liver diseases, such as cirrhosis, fatty liver disease, or hepatitis, this combination can be especially dangerous. Studies from the American Association for the Study of Liver Diseases highlight the fact that the liver is the body's primary filter, and its ability to process toxins is reduced with regular alcohol intake. Adding acid from lemon juice worsens the situation by irritating the bile ducts and further impairing liver function. This can result in acute episodes of liver failure and serious liver damage, including the destruction of liver cells. Research conducted by the National Institute on Alcohol Abuse and Alcoholism has shown that combining alcohol with acidic ingredients increases the risk of liver inflammation and worsens conditions such as cirrhosis and alcoholic hepatitis. Furthermore, regularly consuming alcohol with a highly acidic ingredient like lemon juice can speed up the progression of chronic liver disease and potentially lead to complete loss of liver function. The story of John Williams, a 55-year-old man from the United Kingdom, serves as a cautionary example. John enjoyed making refreshing lemon cocktails for himself and his friends. One of his favorites was gin mixed with a generous amount of lemon juice. He had already been diagnosed with non-alcoholic fatty liver disease, and his doctors had advised him to reduce his alcohol consumption. However, John continued to make lemon cocktails, believing the natural acidity of the lemon would counterbalance the harmful effects of alcohol. A few months later, after one of those evenings, he was rushed to the hospital with acute liver failure. Doctors confirmed that the combination of alcohol and citric acid had caused irreversible damage to his weakened liver. To avoid such dangerous outcomes, especially if you have any liver-related conditions, it is best to avoid combining alcohol with lemon juice. The American Liver Foundation recommends that individuals with chronic liver disease limit their intake of acidic foods that can increase the burden on the liver and avoid alcohol altogether. If you enjoy the flavor of lemon in drinks, consider adding it to non-alcoholic beverages or drinking lemon water in moderate amounts. For those who choose to consume alcohol, it is safer to opt for combinations that do not contain acidic ingredients. Herbal or fruit-based blends can serve as a gentler and safer alternative. Additionally, regular liver function monitoring and consultations with a medical professional can help you stay ahead of potential complications and protect this vital organ from irreversible damage. Number 1. Excessive consumption of lemon juice on an empty stomach and in cases of stomach ulcers. Lemon juice is often seen as a healthy part of a morning routine. Many people believe it jumpstarts the metabolism, aids digestion, and helps detoxify the body. It is common for people to begin their day with a glass of water mixed with lemon juice on an empty stomach, thinking it supports overall wellness. However, this popular habit can be extremely harmful for individuals with stomach ulcers, gastritis, or even those prone to high acidity levels. Lemon juice is highly acidic, with a pH between 2 and 2.5, making it harsh on the stomach lining, especially when consumed before eating. When the stomach is empty, its protective lining is more vulnerable to acid exposure. According to research from the American Institute of Gastroenterology, citric acid from lemon juice can irritate the stomach lining, causing inflammation and tissue damage, which may lead to the formation of ulcers and erosions. For someone who already has an ulcer or gastritis, drinking lemon juice on an empty stomach can severely worsen their condition, leading to intense pain, internal bleeding, or even ulcer perforation. Studies from Stanford University School of Medicine show that acid-related stomach disorders affect millions of people worldwide. According to this research, regular exposure to strong acids like citric acid can speed up the development of ulcers, particularly when a person does not follow a balanced diet and consumes acidic beverages on an empty stomach. Additionally, the Medical University of South Carolina points out that overconsumption of acidic foods on an empty stomach can disrupt the body's pH balance. This increases inflammation and damages the mucosal lining of the digestive tract, raising the risk of gastrointestinal issues and contributing to chronic conditions such as gastritis and peptic ulcer disease. The story of Thomas Berger, a 42-year-old from Germany, is a clear example of the risks tied to drinking lemon juice before meals. Thomas, committed to maintaining a healthy lifestyle, drank a glass of warm water with lemon every morning before breakfast. He believed this habit would cleanse his system and improve digestion. But after several months, he began experiencing severe abdominal pain and frequent heartburn. Medical tests later revealed that Thomas had developed a stomach ulcer. His doctors explained that drinking lemon juice on an empty stomach was a major factor in aggravating his condition. To prevent problems like this, it is important to monitor your lemon juice intake, especially before eating. The American Gastroenterological Association advises individuals with ulcers, gastritis, or other stomach issues to avoid acidic foods and beverages like lemon juice, particularly on an empty stomach. If you do not want to give up the habit entirely, try drinking lemon water after a full breakfast, when food in the stomach can help protect the lining from acid. For those with high stomach acidity, it may also help to dilute lemon juice with a larger amount of water or switch to gentler alternatives like herbal teas or warm water with honey. The National Institute on Aging emphasizes that maintaining a balanced diet and consuming acidic foods in moderation can help protect your stomach and prevent the development of chronic conditions. If you are already experiencing stomach problems, it is essential to consult a doctor and follow their dietary guidance. These simple precautions can help you avoid serious complications and keep your digestive system healthy for years to come. If you have questions or want to share your experience, feel free to leave a comment. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.